We now try, instead of trying to get rid of every cancer cell, we try to see if we can treat cancer more as a chronic degenerative disease. Get the person as healthy as possible, and perhaps they can live much longer and maybe even a normal lifespan with the cancer in their body without focusing so much on killing every cancer cell, but instead focusing on the body's defenses and keeping the cancer under control, keeping it from growing, keeping it from invading, keeping it from metastasizing to other areas of the body, because it's that process of invasion and metastases to vital organs that really kills the patient, usually then more than the individual primary cancer in the first place.
One of the tragic aspects of this blinkered view of what should be done with cancer, the kind of treatments that should be used, is so apparent when it comes particularly to chemotherapy, because what we see is the fact that chemotherapy can work very well for a certain number of cancers. If you're talking about testicular cancer, childhood leukemias, certain lymphomas, there are a number of good examples where chemotherapy can cure people. But for the vast majority of the most common cancers, which include lung cancer, advanced metastatic breast cancer, colorectal cancer and prostate cancer, and many other GI cancers as well as gynecologic, including ovarian. There is some benefit in early stage disease using the conventional treatments of surgery and chemotherapy. But once a disease becomes advanced, chemotherapy and radiation, but particularly chemotherapy, has proven to be wholly inadequate, and it really makes very little difference in extending lives.
There are very few cancers that respond to chemo and radiation. The cancers that are caught earliest and are removed by surgery have the greatest chance of survival, and that's been known for many years. And the statistics about cancer survival, even with chemo or radiation, are a little bit misleading because they talk about 3-year survival rates. Many patients will survive 3 years without any technique or any therapy for cancers. I have a patient in my practice now who's well into her 80s. She's had a breast cancer for maybe 10 or 15 years. She's never done anything. The cancer's still there, but she's still alive. I think to some extent the chemo and radiation damage the body so much that people become more ill and they can die from the side effects of chemo or radiation or a weak immune response, and the cancers progress because of the damage that's incurred on the body by those techniques.
There are 4 major negative factors that are associated with both radiation and chemotherapy. The first is that they're both carcinogenic. That is, they cause cancer. So you have these treatments which are supposed to cure something or help something actually causes the very thing it's supposed to help or cure. So they're carcinogenic or cancer producing.
Chemotherapy itself can cause cancers. In fact, if we take breast cancer protocols that have what we call alkylating agents, which is Cytoxan, methotrexate, and many other drugs, they can actually cause leukemias in the future. Radiation that's used for cancer can also incite cancer itself, such as breast cancer. So chemotherapy in itself, you might win one battle but create another war.
The second thing is that they are mutagenic, which means they cause mutations, and that's part of the mechanisms by which they bring about the development of cancer. So both radiation and chemotherapy are mutagenic. They cause mutations. The third issue is they are immune suppressive. So the body has various defenses that it uses to try to get on top of cancer. We have built-in mechanisms to try to control the disease, prevent the disease, and here you have treatments that impair the very systems that are necessary in the body to have long-term control of the cancer. And the fourth factor is they have unbelievable side effects in many cases.
I mean, we know that chemotherapy will essentially kill any fast-growing cells in the body. It doesn't discriminate and pick out cancer cells and selectively attack them. That's the worst aspect of chemotherapy. It's going to kill any cell that's fast-growing in the body. So the GI tract, where the lining of the GI tract involves very fast-growing endothelial cells, is going to take a huge hit resulting in the major GI side effects, as well as the nausea and vomiting that we associate with chemotherapy. And then, of course, there are many drugs that patients have to take to subdue the nausea and vomiting, which involves that much more cost to the system. And some of those drugs have side effects.
They lower white blood counts in many cases. They lower platelets. So white blood cells are a part of the immune system. Platelets are needed for blood clotting. And if you lower platelets too much, you can have bleeding episodes, and people sometimes die from bleeding out due to drops in platelets. You get severe infections due to the drop in white blood count.
You see some of the deaths associated with cancer treatment involve out-of-control infections resulting from the suppression of the immune system by chemotherapy.
You get nausea, you get vomiting, you have loss of appetite, you get weight loss. You get, not only from the cancer do you get cachexia or wasting of the body, but from the radiation and chemotherapy you can get those kinds of treatments.
Patients often tell me that the worst thing that they experience is fatigue, and it's not addressed adequately by the system. I mean, if you're going to give people these drugs because you claim you have nothing else to offer, there has to be a fix for the side effects. And there could be, and there should be, and there isn't.
I think what we need to do when it comes to cancer therapy is be very selective. And by selective, I mean we want to focus on inhibiting or killing cancer cells and at the same time not harm normal cells. And in fact, if we can, even promote normal cells and encourage their health. So this is what we try to do in our practice. We try to select as much as possible agents that will be very selective and will be helpful to the cancer patient to help them control their illness. What I tell patients when they are trying to make a decision as to what kind of conventional treatment they should do, if any, I say they have to focus on three main questions. The first question is, what is my survival value? If I take this treatment, am I likely to live several months longer, several years longer, several days longer, or at all? Am I going to improve my survival chances by taking this treatment as compared to doing nothing? The second question is, what is my quality of life going to be? Am I going to be healthier and happier and feeling better, or am I going to feel worse? And as we know, the severe side effects from radiation and chemotherapy often will have people feeling worse. If there's no improvement in survival value and you're just going to feel worse from quality of life, what's the point of doing the treatment? As I see it, the main treatment is that it's cultural, it's financial, the standard of care. This is how we do it. We don't pay any attention to making people healthy. We pay attention to killing tumors by using these very harsh treatments.
I think the primary reason is the profit motive, where there is a tremendous vested interest in sustaining a system that relies upon drug sales and radiation and surgery that involves billions of dollars each year in medical costs and profits for the healthcare companies as well as the insurance companies. And the result is there is little funding for alternative therapies, for natural therapies that in many cases can be complete alternatives. In some cases can be used as adjunct to conventional care and make an extraordinary difference in improving care, ultimately saving the system millions, if not billions of dollars. But the cost analysis is never done. The research is very paltry in alternative therapies. There's been some increased effort in recent years, but it's clearly insufficient. The system, it's not a conspiracy necessarily, but the system operates on its own profit motive, and the individuals caught up in this system, the doctors, the physicians, the nurses, everybody involved in providing care, are not exposed to these ideas sufficiently, and there's just simply no commitment to the thorough research investigation of these approaches, and certainly not to the implementation within medicine. The potential of natural and alternative therapies to enhance the health of cancer patients, to improve their chances for long survival, and to improve their quality of life is really enormous and almost to a great extent untapped because of this monolithic medical system that really has no particular vested interest in pursuing those therapies.